I was working in a UH, a large academic center here. I was director of Mohs surgery there, and it was a terrific time. I had a great team, had wonderful mentors, but I wasn't 100% happy. And I started developing my idea of like, listen, I got frustrated with patients showing up and saying that they waited months to see me, and I started thinking there's got to be a better way to tackle that access problem. And that's kind of how the idea of Apex started. I can't really tell you there was a time, but I think that mentally I was ready to do something different. I had done my academic career, had a very good mentorship, and I felt like there's never a good time when you have to do this type of change. So I remember talking to my wife and telling her, "Hey, listen, I really think this is what I want to do. I want to create something really special." And then I give her a lot of credit because she told me, all right, well, let's go for it. Is that what you want to do? Go for it. So there was no particular time that was planned. It was more of a gut feeling. Hey, you know what, let's just try it out. And, we had two little kids at the end, at the time. So there was never the right answer. And we'd say, hey, let's just do it. And we did it. And I did it. So what I wanted to do was really create a special organization where people had growth potential within the group so that there's people that we can kind of help professionally, but also help the patients with access. I started with 3 people, at Concord, and we started hustling, right? Starting to connecting with providers and connecting with the community and really building the name of Apex, letting the people know that we mean taking care of you the same way we take care of family, or, we take care of you have a cancer, we get you in right away. We started paying those attention to details. And when we started, I was responsible for the staff, right? So I didn't want to fail the staff, right? So when you have people, families that you're supporting and counting on you, I felt even extra pressure. I say, hey, we got to make this really good organization. And I remember our very first Christmas party that we had, a little holiday party. We were in a booth at a restaurant with like 4 or 5 people. I mean, not maybe 6 people. And over the years, it's been a dramatic change. And we support a lot of families now. It's been a really cool journey. Healthcare in this country is challenging too. When you're opening a new practice in the middle of a lot of big academic centers with big branding, it's a big risk. So I feel that the reason we've been doing so well the last several years is because of that, because of our culture and our people, our staff. When we first opened, it was standard general derm, Mohs, maybe half a day a week. We didn't really do a lot of aesthetics at the time. Aesthetic services take time to develop and buy the blazer. So it was just basically bread and butter dermatology, acne, psoriasis, anything. But in my brain, I had this vision that I wanted to create something really special, something that we have now, where we have all the verticals. We have a laboratory with DermPath. We have clinical trials. We do Mohs. We have aesthetics. So this was all part of my vision for the group. It's still developing. But when we first started, it was just me and our staff, and there was no clear role responsibility. We were doing everything together. Everybody was really working really hard together so that we can get the practice up to speed. I did a lot of talks in the community, a lot of connections, a lot of dinners with providers. So I was trying to get my name out there so that people know who we are and what we stood for. I think it was our attention to detail and access, right? We have people that were waiting months to get into dermatology because they had a skin lesion or something, and we get people right away. Even to this day, actually, I'm very proud that we still are able to basically give into that value proposition, which is rapid access. What happens is that people are not used to it. So when people call and we tell them, hey, we can get you in right now. You want to come now or tomorrow? That's how it is for skin cancer too. Like my patients call in and I tell my staff, let's put them in right now. I'll do them right now. So I think it's really cool to be able to have that flexibility. So I would say that was a big differentiator. As we started, I think that was the key. Probably took a year and a half, because I remember first 6 to 8 months, I was there with my staff and sometimes we see 5 patients, right? So it took a while. There were a lot of those early obstacles. But I would say that, we still had the same team, we still have the same approach. And I think that word of mouth really kind of helps when you start a group. So I think a lot of other people were coming to see us and saying, hey, you guys have a really cool team, and that kind of helped us getting the word out. But the first couple of years, they were hard, just like startup. So there was really never a vision to have all these offices and things like that. It was more about market share. I started thinking, well, maybe if I have, another office somewhere else, maybe that'll help us with kind of growing that particular location. So, I would say that it was by trial and error. And then we had a couple of providers that wanted to join us. They were looking for jobs, and we're like, well, we're not ready, but we can try it. And that's kind of how we started. And then I realized pretty quickly that to do something right, you have to have the right structure. And, I started kind of building a management team that could help us work. And, I'm as a physician, I'm a Mohs surgeon, right? So I want to be able to do Mohs surgery, do skin cancer. I'm not an accountant, so I started assembling the right team in the back office so that we have the right team managing the group. And that has been a constant challenge too, because it's always about the people and about the leadership. And I feel that, as you grow as a company, you need to kind of grow leaders. You have to have that pipeline of development. You have to kind of get the right people in the right seats, develop those relationships. So that is an ongoing battle, right? Making sure the team is right. But I think that looking back, I think we've done a really great job kind of hiring people, keeping people. I'm super blessed that the first 3 people that are from day one in our group are still with us. I mean, that's huge with all the changes that we've had. And obviously they've done really well. They've advanced their careers. 15 years later, they're managing things. Their roles also have changed, which is really cool. So that gives me a huge pride and joy, because that doesn't happen by accident. So I feel that we've done a really good culture and build the right reputation and foundation for those people to stay and kind of really grow their careers. And I hope we could continue bringing that new leadership here, new kind of fresh, younger population of leaders, so that we can develop them and they can continue to help us kind of grow forward as a team. So in dermatology, my vision was always a 360 approach of patient care. I always hated when I take my parents to the doctor. You can do a thing one place, but then, you got to go to another office to do something else, and then you got to do the other place. So for me, it was always the vision of trying to do everything internal. So if you're a patient, you come in, you don't have to go somewhere else to get stuff done. So that was the original idea. And the cool thing about derm is that you do aesthetics and you do kids and adults, and we really treat family. It's like a continuum. I always tell people our patients are patients for life, because you can see them when they're a teenager, then 20 years later you see them for rosacea, or maybe you see their mom and dad for skin cancer screenings. So, I think that part of the vision was to develop the aesthetic side, develop Mohs, and kind of make sure we're available for that skin cancer pipeline in terms of access, have that fast access. Also doing our own laboratory. Having the internal lab is huge for our patients. It's quality control, it's fast turnaround. You don't have to wait 3 weeks to get a pathology report. So we have a terrific team of pathologists that are dermatopathologists. That's all they do is skin pathology. So I feel that we've arranged all the experts in their field. Same for aesthetics, right? We have tons of excellent aesthetic providers where they're doing lasers and devices and injectables, everything backed by science. We're not just winging it. And the last thing that I wanted to do was clinical trials, which was really, that's more of a recent thing, maybe 5 or 6 years ago that we started, which is another huge added value, because now our patients have access to medications that nobody in the world has. Think about that. So we have patients with vitiligo getting treated with things that are not in the market yet. So it's a really cool pipeline that allows us to be in the forefront of really the newest technology, newest therapies for dermatology. I'm spending more time on that because I think that's really cool. And I really like the challenge of kind of helping the future. Really, we're designing the trials for the future. And whenever they approve a medication, we were in the paper. We wrote the paper. So it's really cool to be, in Mayfield Heights or Concord, our little center. It's been recognized in the world. We had a trial for a genetic condition that's really rare. We enrolled 5 patients, which is a lot in that particular subject or diagnosis. And we were probably top enrollers in the world for that trial. When you think about that, from the 30,000-foot view, that's impressive. I think that clinical trials adds another dimension to the vision. And now I can say that, hey, we have pretty much everything covered in dermatology. In the future, we're probably going to add more things as things develop. But I feel that we have a really good foundation to kind of grow in all those departments, which is awesome. The other thing I did early is marketing. I remember hiring our initial marketing, director. And I remember telling her, listen, I know a lot of people don't market their practice. It's not very common, but I want to put some marketing structure in here. And I think that's another thing that we've done really well, because we are out there in the community. We've done everything, radio, TV, billboards. We're out in the community doing events. We sponsor races. So that's kind of how I roll in our group. That's what I love about our group, because it's really grassroots. I mean, we're built in Cleveland. We don't have people in New York City or, dictating our career path. We're basically in it. And I think in this area, people respect that. We've grown with the community, which is really cool. I would tell you that every time we open at a new facility, it's really cool because we have all the chamber there and we do the ribbon cutting and all the providers and helpers are there, people that really worked towards that goal. That's always really cool. One of the highlights is when my mom actually cut the ribbon at one of the recent ceremonies. That was really cool. I gave her the big sister, go ahead. But I can tell you that every time I see a patient and they tell me, I can't believe that you guys got me in so quick. To me, that's huge, because to me, that still say, hey, even though we now have 15 locations, 50 providers, we're still doing the stuff that I started way back when. So to me, that gives me satisfaction. Another one is every time we have an event, I always like to see people outside of work, kind of in their normal clothes or not with their scrubs and things like that, and have a family event, or we have the kids. So I'm a big family person. I got 4 kids, and to me, having that sense of family and community, even though we're big and we're spread out in the community, in the region, I think that's important. So whenever I see the staff engaging with their family in an event that we're sponsoring, that's always really fun, because I look back and say, man, this is great. We're helping out the community and we educate them about skin cancer. My vision for Apex 2.0, I call it, it's really continuing with our access availability. So we are expanding our Hudson location, which is awesome. We're going to have 10,000 square feet of medical, aesthetic, and surgical space in the first floor, which is going to be really good for our patients, very easy in and out. We are also helping in the Canton area with an alliance timeshare, which is going to be really, really cool. We want to make sure we are in the community where they need dermatologists. We always try to partner with the health systems so that they know, hey, we want to help their providers with referrals for dermatology. I would say that we'd love to continue with recruiting our providers so that we can continue serve our population of patients so that we can guarantee that same day access. And definitely continue to grow the aesthetic side and the clinical trial side, because I think there's a lot of new growth that comes out there. And we're doing GLP-1 and that therapy with muscle building devices and radio frequency to increase kind of collagen in the face, and really continuing to get leaders into our group. We're structuring the group so that we have more providers that can step up as leaders to help us kind of with really continuing the mission of transforming lives with healthy skin, which is really the root of what we do. I tell people we're the rock stars of dermatology. What that means to me is that when people come to our office, they are nervous because maybe they have cancer or maybe they have psoriasis in their body and they're self-conscious, they're depressed, and they come into our office. That's our stage. And when they come out of there, they come out cancer-free or with a treatment plan, or understanding that this is what we're going to do to get your acne clear. That is huge. The patients are very, very appreciative. And then they tell people, kind of when you saw a contract, man, I saw these people, I loved it. Well, that's what I tell people. That's the experience we want to have at Apex. When you come in, we're going to help you get back into the game. We're going to clear your skin, whatever it is. We're going to make it go away and make you feel yourself. And then you tell your friends. And then that's how we grow the practice. And I want to make sure that we continue that. And the leaders are really important on that. We're also looking into incorporating AI also in what we're doing, right? So that's in all industries. But there's a lot of cool projects that we want to do with teledermatology and online visits and, really incorporating AI so that we can spend more quality time with the patient, right? That's also in the works, which is really cool. So I'm excited for the future. So Apex was not in the radar. I was thinking about what name to call the company. And I was talking to my kids, and then they gave me some names. And I was looking for something that starts with an A, because way back when, remember, this is like Yellow Pages time. There was some tech, but not like it is now. So I was thinking, I want to make something that starts with an A and has 4 letters, so that if you do, I was always thinking, maybe you do 1-800 like Apex or whatever. And then I started looking at something that looks the top of the mountain, the kind of leading edge, kind of top. And then I thought, Apex is cool. It's catchy. So, that's kind of, I went with that, and I really like the Apex. You can't really put that to words, right? I think that when you're in the healthcare field and you're a provider, you have that special bond that you have with your patient. They tell you stuff that they don't tell anybody. They share, they share their bodies with you and they, hey, I got this in a sensitive location. So whenever we make that type of difference, that's, to me, that's what it's all about. I want to make sure that we continue over the next 15 years to really move from a derm group to really a skin health platform so that we can develop more impact to the communities. I feel that that's something that's really cool to have that goal, and I feel that we're definitely going in that direction. We want to make sure we are that group that we know, hey, we're going to take care of this because we know how to do it and we know what the new medications are, and this is what you need. And every time we have a cool comment like that from a patient, or even it may not be my patient, it makes me feel that the whole team does really well, and it's a team effort. And I think that I'm speaking on behalf of the providers, that every time a patient puts a note there, it reflects them, but also reflects everybody in the company, because the company starts, the visit starts with the front desk and the MA that works with them and the person who's checking them out. There's so many people behind the scenes that making it work. And I'm so appreciative of our team. And I think that, speaking on behalf of the providers too, like, we couldn't do what we do without our team and our staff. And to me, that's huge. I'm always talking about how much of a culture we are, how collaborative we are, and how the importance of having meaningful relationships at work is important. So my dream is that people in our practice develop those relationships with the patient, but also with their staff, so that they can help each other out. But it's great to hear those things. And we're not perfect, because I know we also have some negative reviews, but I can tell you that, for the majority of the time, we're definitely changing lives. The Purple Heart Project started years ago when I was trying to pair up some type of community service that matches my prior military background with dermatology. And I remember years ago in the Boston Marathon, there was a bombing that happened. And I think that plastic surgeon group or something was doing something for those burn victims. And that resonated with me. And I'm like, you know what, maybe I can do something like this for vets, people that are wounded in battle or in combat, that that they have PTSD, they're going through a rough patch. Well, if I can do my part and help some of those scars, maybe they'll go back into the game and feel better about themselves and kind of go back into the workforce and do all this stuff. So, that was the original idea, and we just started doing it. It's always cool to hear from vets, that have had those things, and whenever we can, we help. I can tell you that in dermatology, we can't help everybody because there's some scars we can't help. Some people need surgical plastic. So if we can help them with some laser, whatever, this scar revision, we'll do that. And what I like about this program too is that we're trying to develop it and grow it, right? And not just from that side, but also maybe becoming almost like a center for providing healthcare jobs to vets, right? So the Purple Heart Project started with an idea of helping vets for scars, but it's really about developing into, can we help vets with the workforce in healthcare, those who want to be in the healthcare? Can we reach out to VFWs and VAs and, hey, we'll do skin screenings, very active. There's a lot of sun exposure in the military. When I was in this military, we pushed sunscreen, but nobody uses that stuff when you're in the 130-degree weather and you're sweating. People say, sure, doc, and throw it out. But the bottom line is that I think that raising awareness of that is important. And I think that program is developing into that, and maybe touching first responders too, not necessarily just vets. We're evolving the program, and it's really cool because something different. And every once in a while, I get people from other states telling me, hey, what do you guys do over there? And I share my idea to them, and I encourage them to do it. This is something that we do that's special in Apex. Melanoma Monday is always the first Monday in May every year. And this is a tradition that we've had since I started the group. We basically open all our offices. We do tons of free skin cancer screenings. Our providers can donate their time. We see hundreds of patients every year. I can tell you that probably at least 10 or 20 skin cancers are diagnosed during those free skin cancer screenings. So I think it's a huge thing that we do in the community. I don't know anybody else in the community that's doing that, which is really cool. And I think the patients like it too, because I think that you can get people that have never seen you, but they come in this day and age, some people don't have insurance, they may have something, and sometimes you can reassure them, hey, listen, that's nothing. You can see their face, good. So I feel that definitely helping the community, and I think we do a really good job. And we actually also do skin screenings other times during the year. The Melanoma Monday is our biggest one, but we also, every once in a while, do open houses and we do screenings, or we go to specific companies and do like a screening for their employees. So that's our way of kind of letting people know, hey, you know, if you got skin issue, we can tell you what it is. And I think it's important. And sometimes we catch people that think that, oh, I've had that for years, and that's something bad. So we tell them, hey, you know what, don't, that's something that's bad. You really have to get that up. So some people really take ownership of their healthcare, and instead of blowing it off, they take your recommendation. Okay, maybe I should get this stuff done. So I think it's really cool to do that. I can't really put it into perspective, that number. I remember when I started, like I told you, I was seeing 3, 4, 5 patients a day, maybe doing a handful of Mohs surgeries a week. And then, you know, because of our growth now, we've seen over 1 million patients total as a group. That's amazing. So getting to 100,000+ skin cancers treated, what that tells me, which is great, I think, is those patients in the community that need skin cancer treatment, usually you want to go to a place that has experience, especially when you treat with cancer. So I feel 150% comfortable that if you have skin cancer, you come see us. Well, you know what? This is not our first rodeo, man. This is what we do every day, right? So any doctor that you see in our group, that's our craft. And if you do see our most surgeons, they're fellowship trained, done thousands of this a year. And I think that's what you want. You want to go to a specialist that really knows what they're doing, and they're going to make you feel comfortable, and they're going to do it efficiently. They're going to do it within an hour and a half, you're out of there. You're not going to be there for 10 hours. I feel that when you start looking at those numbers like that, they're huge. So it tells you how much impact we're having at the community, and 100,000 diagnosed and treated skin cancer. I feel early detection is important, treating is important, and if we can do that in our office, that saves the system money, helps the patient continue with their life. You don't need any extra chemo or radiation, and you're back at it. So I had Mohs myself. I had Mohs surgery a month ago in our group. So I was a patient, and I can tell you that it's a very easy, procedure, and it's very easy on the patient, and our team does a great job. And I'm not saying it because I work here. I had Mohs in Westlake in my forehead. Because, I'm always scanning my skin, and I'm like, oh, that's a basal cell. I went to our office, had a biopsy, and then we had the Mohs done. So I am a patient too. Well, I do want to close by telling our patients and our staff, thank you very much for the trust that you put on us through all this 15 years. It is super special that you trust us with your care, especially in skin. I encourage you to continue checking your skin, being proactive, being skin smart, and tell your friends if they have skin issues, they need a dermatologist. We are there for them. But I want to thank you for all your support through all the 15 years. It's been a great journey, and I can't wait for the next 15 years because we have some great stuff coming up in our programs, and I'm excited to start sharing those with you soon.